two kinds of people. Those that have good health care, that have access to care, and others that have abysmal access to care. One in particular, while we were visiting the Sioux Lookout Health Center, we met one of the doctors in the emergency room. He was talking about, he said, in the last 2 hours, I'm going to give you a sense of the types of clients I've seen. And one in particular, this young lady who's there who has an infection in her blood. She needs to be in Sioux Lookout, 650 kilometers from her family, not able to see her children, for 6 to 8 weeks, so that they can give her IV on a daily basis. And he said, this is unconscionable that a young woman would be away from her family, away from her child, and some of the children sometimes are somewhat left to themselves. And he said, this young woman looked at me because she could see other clients who lived nearby, access to Sioux Lookout, who were coming in and they could come get their IV, then go home and be with their families. And he said, this young woman looked at me and said, is it because I'm Aboriginal? Is it because I'm poor? Is it because I'm both Aboriginal and poor? And that really struck with me. That really struck with me. And at the same time, on a very hopeful way, we have amazing newer facilities that are very sensitive and that have brought in the communities to really create centers that are very caring. Let's bring people so that their voices are heard through many different manners. It takes a lot of time to build the trust, to build the language, to build the understanding. It's about the history, the culture, how to converse, how to approach, not make assumptions, but know of the expectations. So you can look at programming. You can look at even treatment in different